So I'm going to frame tonight's talks by introducing some scalable solutions and reasons for hope. And I'm going to start out, thank you, with some, and throughout my presentation, I've included images from the 5th National Climate Assessment, which was just published last year. I was a lead author on the air quality chapter. We also have faculty who were lead authors in other chapters from UW, including the health chapter. But I think this image captures some of the anxiety that people are feeling related to climate change, particularly young people. And it's important that this report included a lot of artwork and imagery speaking to young people. It's one of the many innovations in this report, and gets to one of the central problems that we're here to work through tonight. There are lots of ways in which climate change interacts with mental health, but one of them, and an emerging one, is climate-related anxiety, which everybody, I think, knows what that means. When Hillary posed the question, you were able to respond to it. Of course, we're doing what we do and defining it more rigorously and doing studies to determine how prevalent it is. In fact, among certain populations, it's quite prevalent. It's quite worrisome that climate-related anxiety and anxiety around a number of other things, too, is a significant concern for younger people and a lot of our incoming students. This is a really significant motivator for people coming and getting public health training and interest in something they want to include in their careers, even if they're not focused on environmental health and climate change going forward. But there's, I would argue, and some of our colleagues have very effectively argued, a number of reasons for us to be hopeful. In fact, we spent a lot of time trying to understand the problem, and a lot of the talks, probably the one I gave several years ago in this venue, was about what the problem was and what the linkage between climate change and health impacts is. We're beyond that now in many cases. We are very clear what the problem is and how climate change damages health. And we're at the point where I think understanding the problem is really just the first step toward addressing it. And we need to, in doing that, rely on our mission, our shared vision around public health. And that's the source of our hopefulness. And trust me, I've sat with these problems since basically the beginning of the 21st century in lots of ways. And there have been periods where I have felt quite hopeless about it. I've felt depressed about it, deeply concerned. And I can still go there. But I think there actually are a lot of reasons to be hopeful. And I think that hope is quite essential for effective action going forward. And our former dean, Howard Frumkin, did some work on this, in fact. He articulated why hope is an essential aspect of climate action. In the paper that he cited, he looked to other scholars who have highlighted that hope is the perceived capacity to derive pathways toward desired goals, and then to motivate oneself via agency thinking to go forward via those pathways to achieve the changes that you're looking for. And this fits right in. Our goal is health protection. It always is, it always will be. And we take an evidence-based, community-engaged approach to public health practice, and our knowledge and our experience and our connections with community are the foundations of our agency. And you're going to see that tonight in a little bit of what I'm going to talk about in terms of the work I'm doing, but definitely in the work that Rachel and Esther are going to present. And I'm going to present to you quickly 3 reasons for hope. So the first one is that the problem is bad, but it's not quite as bad as we thought it was even 5 years ago, which, from my point of view, the main reason that's good news is it gives us a little more time to react. Because the problem is not just that the climate is changing, it's the rate at which it's changing. The rate at which it's changing outpaces a lot of the things that we can do to address it. And with more time, we can do more. And so we have gone from a trajectory where in that sort of desert rose wedge there, no climate policy several years ago, we were looking at maybe 5 degrees Celsius of warming by the end of the century. Pretty catastrophic level of change. We're now, with current policies, probably going to limit warming to around 3 degrees Celsius. It's still not ideal, but it's a lot better. And if we activate and carry through all the pledges and targets that we have in place, we actually could limit potentially to a little over 2 degrees Celsius, which is getting to the point where I would argue is manageable. I put in quotes, but anyway, we can talk more about this. But I do think this has been a significant change in our perspective around climate change in the last several years, that we understand the problem is not quite as bad as we thought. And the reason that that's important is that the more we mitigate against all of these different cascading impacts on all sorts of different sectors, it frees us up to adapt to the rest of it, which we're going to have to do one way or the other. We're going to have to absorb these changes on health, on human well-being, and all the ecosystem changes that we're seeing. This is another image from the National Climate Assessment and a vision for cleaner, alternative sources of energy to drive the changes we need to see. And that links up to the second reason I think that there are reasons for hope. And that is that we're really genuinely starting to invest quite heavily in a lot of climate solutions. And most of them are mitigation oriented. And one of the great news features of mitigation activities is that they, in fact, are very good for health. Incidentally, I mean, they're designed to reduce risk related to climate, but almost all of them, they reduce use on fossil fuels, they increase physical activity, they improve population health. And they improve population health almost immediately, really on a time span of several years. And they also reduce the likelihood of dangerous climate change. So they're very beneficial for health, and done right, they are very impactful on health equity as well. And you can see there's been historically this uncoupling between fossil fuel dependence and productivity. We've seen sustained economic growth in many societies, and I actually had to cut this table off when I put it in here so you could see it, because there's another 2 rows of countries where you see the same trend, an uncoupling between fossil fuel use and economic growth. And it's been significant. We've really seen substantial reductions in greenhouse gas emissions along with sustained economic productivity. And we can continue that. We can, in fact, can accelerate it going forward. And we can talk more in the groups about all the different pathways through which mitigation activities benefit population health. There are a lot of different mitigation activities, and they all affect health in different ways. Fossil fuel use is a significant one and a common thread, but it's not the only one. Active transport and other things and improvements in diet are also significant drivers. And we know how to make decisions so we maximize climate benefits and health benefits. That you want to be in a place where you are maximizing the climate benefit and the air quality health benefit or other health benefit, whatever it might be, and not in a place where you're maximizing only a climate benefit or only a health benefit. You could also add a third axis to this around health equity, which is important, and I think we're doing a pretty good job of in Washington State, not so much in some other places. Third reason for hope is that we know how to protect people's health. We know how to protect people's health from climate-sensitive hazards like heat and extreme weather, and we know how to do that in a way that protects health equity and advances health equity, and we are ready to implement it. We need the resources to do that. And we need to learn more as we do it, which we always invest in. But we are ready to do that. Climate change does cause a lot of different adverse health impacts, a lot across all sorts of different pathways. But we are in a position to adapt to most of those, again, given the resources and the intention. That I think that climate change is essentially our generation's HIV/AIDS pandemic, that we need to devote the resources that we put toward HIV and AIDS. That magnitude of resource needs to go to climate change, and then we will be able to address all the challenges that are ahead of us. And one of the things that we need to work on is decision support. And Hillary referenced this tool we have developed with generous support from the Dean's Office and other contributors to the School of Public Health. We've developed a tool that helps us do risk assessment related to extreme heat in Washington and link a very granular risk assessment, place-based risk assessment with risk reduction opportunities and guidance around implementation. I can tell you more about that in the group too. I don't want to take any other time here. So in summary, I think hope is essential, though I completely empathize with the struggle to maintain hope at some points when you think about climate change. But we have a mission. We have a goal. We have practice and experience and connections, and we can do this. We know how to do it. We've done it before. We have at least 3 reasons for hope, if not others. And I'm looking forward to my colleagues telling the stories that they're going to tell about other ways and reasons for hope as we move forward. So thank you.